Thanks, Lon. Well, good morning all, or good afternoon all, depending on what region you're in. I know everyone's busy, so thanks for joining us. I'm Christine Henderson, as Lon said, and I've been in healthcare a little over 20 years, not to age myself, but most of that time with Cigna and United in the payer space. So when I talk about business processing and operations, it is from the standpoint of having been in the trenches and not from the consulting side per se. So table of contents, what we're going to kind of do, I don't need to read this to you. I always assume everyone can read, and I've never been proven wrong on that assumption. So we're just kind of go through the areas of expertise for Catalyst, what we can offer, how we can prove that we're bringing value to your company, our implementation approach, the different ways we can price that, and then kind of end up showing you some of our current partners and accolades, and leaving some questions at the end, like Lon said, time for us to kind of chat if we have anything. When we first look at Catalyst BPO services, so a lot of health plans are increasingly using BPO outsourcing so that they can focus on what's important to them. So it helps them drive down their administrative costs and takes that time and burden off their plate so that the health plan can concentrate on what they need to concentrate on, and that's improving healthcare outcomes for their members. So Catalyst can help health plans achieve objectives by acting as their outsourcing partner in a number of ways. So BPO, which is business processing outsourcing as a service. So we can help with contact center. That would be, calls coming in, calls going out. We're doing that currently, and we're ramping up another client right now where we're making outbound calls to do some COVID scheduling. We do a lot of work in the claim space where we take either all of the claims or a part of the claims and offer relief to our clients. Kind of in that claim space, we also have our OCR functionality. So if even in the most organized plan, you're still going to get paper claims. So our OCR functionality allows us to use our PO box for your claims. The claims come into our PO box. We scan them, we upload them to our OCR technology, and then they're turned into an electronic claim, and we send them through the gateway so that we keep everything together and kind of reduce the time and expense associated with paper. We also work with, enrollment, especially when you're talking about Medicare Advantage, Medicaid, any of the CMS programs. Enrollment can be a bit of a nightmare. So can billing and reconciliation. So we support our customers in that space. Fulfillment, authorizations, medical management, all that kind of falls into the claims lifecycle. If all that goes well, you won't have a lot of grievance and appeals, but nothing is ever perfect. So we also support grievance and appeals. So we make sure that we're in compliance with not only state and federal and CMS, but we make sure we're adhering to your plan guidelines as well. We also offer technology as a service. So that's when we say you're a new plan, you're a new group, you're just starting up, or say you're an existing group and the claims engine you have just isn't working for you, or the customer management system just isn't working to you. We have technology we can bring to bear. So we can say, we agree you have a legacy claim system, it's not working well. Let us bring a modern claim system to the table. So we'll install that for you. We'll help get that uploaded. We'll get that configured to meet your plan guidelines, and then we'll move forward from that. So outside of claims, we also do, telephone systems. We do authorization systems. We do a lot of analytics and reporting. We have a proprietary claim audit tool that we use to capture the results of claim audit so that you can use them to kind of trend what's going on and you be proactive in fixing things. So a lot of information on this slide, and I understand that, but we'll kind of dive into exactly what we do in each area as we move along. So when we talk about service gains and examples for claims administration, because I wanted to give the example in claims just because that's the one that seems to cause payers the most heartache. So the first thing we would do is identify the primary pain points. What is it causing the pain now? Is it volume? Is it inaccuracy of payment? Is it turnaround time? So we look at that client by client. And then we look at the downstream impact. So we look at if you're paying claims incorrectly or slowly, your call volume goes up, your appeal volume goes up, everything downstream from the claim kind of goes sideways on you. And then we look at systematically solving those issues. So we don't believe in a one solve for every customer kind of approach. We have a lot of things in our wheelhouse. We have a lot of quivers in our arrows in our quiver. I guess I had that backwards. But we very much modify it to what you're seeing in your plan. So after we do this kind of overview of where you're sitting, the gains that you can get by letting us solve some of these problems is, of course, like we just talked about, you lower your admin costs, you increase claim accuracy when things are configured correctly and you only have to process things once. We can help manage some of those complex benefit and reimbursement methodologies that are mandated by CMS and more exchange and commercial plans are going. We're of course HIPAA compliant with all of our transactions. We can streamline, like when I was talking about the OCR, we can streamline your paper workflow. We can help get rid of all those paper scans and the entry of paper claims manually and all that good stuff. We can optimize your configuration logic. A lot of times things are falling out of auto adjudication because you configure your system to tell them to fall out. So we look at that and see if it's really necessary for those to bypass auto adjudication. And we can really elevate your workflow, your claim queue logic. The key is with getting the claim to the right person at the right time. So it's one and done. Every time someone touches a claim, there's an administrative cost associated with that. And even if you don't feel like you're writing a check, every time someone touches it, it's between $6 and $8, and it's routed to the next person, $6 and $8. Before you know it, your per member per month cost to process a claim is growing astronomically. Sorry, I have to take a drink. I'm in Colorado, so it's basically, we have no humidity or nothing in the air. Summary of services. So I would first say we're US based. We also have nearshore capabilities we can bring to bear. A lot of our customers want us onshore because of the regulations associated with CMS and some of the Medicaid states. So I'm not going to read through all these. We'll make the deck available to everyone after the fact. But this is just kind of the things that we can do in the call center space, in the enrollment space, the claim space, print mail fulfillment space, authorization processing, medical management that kind of goes with that. And always at the tail end is appeals and grievances. And really, if all the things before A&G are going smoothly, your A&G volume should be minimal. There's always going to be questions around why something was denied or paid the way it was. But if you're clear in your communication, you're clear in your member and provider call center, if you're paying your claims for the benefits and for the understanding of the provider contracts and things like that, and the mail that you're sending out is clear, your EOBs are clear, your EOPs, your remittance advice, make it very clear to everyone what's going on, you see the drastic reduction in A&G, which is what we all want to see because that can drive the STARS rating and all that good stuff. So when we talk about BPO services, sometimes the questions are, how can Catalyst prove that you're doing a good job? And we actually, this is kind of my bread and butter because I originally started in healthcare in audit and in third-party audit. So I'm a bit militant about making sure we do things correctly. And we stand behind that with service level agreements. So, a call center service level agreement, average speed of answer under 30 seconds, service level, abandonment rates, net promoter scores, a lot of, and that's when you send out that survey afterwards and you see if the caller would recommend you to someone else. That's really what you're looking for with a net promoter score. As far as enrollment, same kind of thing. We have new plan setup SLAs, plan updates, new member adds, and things like that. Claims, we stick with what CMS tells us we have to do, but I can say we normally well exceed this. So we have our claims paid within 14 days, 30 and 60, and that's for clean claims. And then we have our payment accuracy targets, and these are pretty much industry standards. I can say we normally hit above these, which is a great thing. And kudos to the claim departments that we have, our managers and directors, supervisors, and the claims examiners. They really do a great job making Catalyst look good. Configuration, so this is when we're almost working as a help desk for some customers. So they would send us tickets saying, this plan is set up wrong. I need you to do this reconfiguration. So these are some SLAs around that. Medical management, same kind of thing. So we talk about emergency, admit, elective, and post-service reviews, and these are in line with CMS. So what we usually do with our SLAs, we look at whoever is the most stringent. So if it's the state, the federal, CMS, the Affordable Care Act, who has the strictest rules, and we shoot our target at that, because then we know whatever we're doing under it is going to be a success. The last one would be appeals and grievances. We just make sure that we adhere to all CMS appeal guidelines, that if we have to send it to an external review, to a specialist or something like that to give a denial or a negative determination review, that we're following that and tracking that. So when we look at technology options, and I apologize in advance for this slide because it will make your left eye twitch. There's so much information on it, and I get that. But we can start a couple ways with technology. So we can look at existing technologies. So, we process on Fastest, QNext, HealthRules, Invitasys, Oracle, these Health Suite, all these kind of things we have experience with, and we have people that have experience with them. And we can also bring, like I was speaking to before, our technology to bear. We can bring in our own claim system, our own workflow system, a self-service system. If we do bring in our technology, we can take two approaches with the implementation. Sometimes a rip and replace, which is a full system replacement, gives people a little bit of heartburn because it's an all for nothing. You either all the way win or all the way lose, and not everyone is okay with that kind of risk. Some people are a little more cautious or risk averse, and we can do a modular. So we could either redo your whole system, everything that touches it, and put in a new integrated system. Or you could say, the only problem that I'm having with is my provider pricing. If I could have my provider pricing, my own claims engine, my own customer contact center, everything else works fine if we could get these things priced correctly. So we'd say, okay, a lot of our technology is modular. We can just put the pricing on, and we can integrate with the pricing. And what it would do, you would keep your existing claim system, it would reach out to ours, get the pricing, come back in a nanosecond, and you would have that pricing within your existing technology stack. So like I said, a lot of things in here. We'll send it out. So there won't be a test later on all these different core platforms and care management platforms. So when we talk about implementation approach, so when we want to go to a BPO solution, there are a couple different things. So sometimes we would use your technology and we VPN into your technology. There are people that we support now that are on our Fastest, QNext, other TriZetto products, and they think their system is good. Those are good products. So they say, we want to keep our system. We want our folks, the healthcare folks, to have access to those systems. We want Catalyst resources just to VPN to the system, use it like they're an employee of the particular health plan, and then VPN out. And the health plan keeps ownership of that technology. So when we're looking at that kind of implementation, the readiness and the startup isn't quite as painful. So if we're VPN into your technology, what we're going to do is we have current training, we have current, standard operating procedures, policies, and procedures. We take out those guide rails, we tweak them based on your specific business, your specific needs. We send them to you, you approve them, and then we back those into our training class. So when we're using your technology, your plan, all this kind of thing, we want to make sure everything we do is in accordance with your rules. If we're going to go with the Catalyst technology, it's a little longer ramp because what we do, you have to go through your normal technology. We do solution architecture. We would do our business requirements. We would translate those business requirements to technology requirements. We would do testing, where you link your user acceptance testing to that business requirement and to the IT requirement, and you make sure everything is set. You have to make sure all your touch points are together, all your integration points and configuration are done. It does take a little longer because it's like installing a brand new system for you. But what's nice is because we've done it multiple times, we can really use the scalability and get you up and running fairly quick. So a lot of times when talking about BPO, they're like, oh, it sounds great, sounds easy, let me get rid of all this off my plate, but how many gazillion dollars is it going to take me? Am I going to double the national debt? And that is thankfully not the case with Catalyst. So what we do before we even determine how we're going to price, we go in and we do a 2-week process so we can understand exactly what's going on. So if we're using your technology and we're looking at prices, we first need to interview it and see what you want us to take. Do you just want us to pay claims? Do you want us to pay claims, do all reporting, configuration, and interfaces with print vendors? Do you want us to do So we just start with interviews. And then what we really do, we review your current process documentation. What do you have now? So that we can kind of get a lay of the land and see what needs to be tweaked. A lot of times, unfortunately, process documentation at the client is something that is not well cared for. So it was written 15 years ago and hasn't been updated since. So we make sure it's updated, we make sure it's current, and we make sure it's applicable. Next, we start looking at your current metrics. I mean, where are you sitting at? What is your turnaround time? What's your appeal rate? Are you getting fines from the DOA, CMS? Are you getting late payment interest fines? Let's try to look at those metrics to determine your current performance and where we can help. So then we develop from that. Once we have all that data, we do a list of assumptions. We're assuming XYZ because your metric, your process documentation and interviews didn't give us that detail. Do you agree with that or not? So this is the point where, the client, the health plan comes back to us and say, you're assuming we have 10% paper claims. We really have closer to 7. Great, that's even better. Fewer paper claims is fewer manual touches to it. So we have a set formula. We would adjust it to 7 and just move forward, and that helps us do our pricing. Really, after we do all this, we give you our findings. So this is our plan. So we say we recommend you do X, Y, Z. These are our concerns around it. These are timelines. These are issues that we're seeing. After that, we'll talk with you. We make sure that we're all on the same page as far as when do we want to start? How long do we want the ramp to be? Are you okay with our standard service level agreements? Or if you want something unique to your plan because you have a particular quirky provider base or something, and you need to make sure that provider appeals are answered within 15 days or something. But we built that all in to the validations. And then finally, what we do is we provide a pricing estimate. So after we get all the data, we understand how many claims you're getting, what you want us to take, enrollment, all the little parts and pieces of this giant quagmire. We'll give you a pricing estimate that says, from what we saw, you need us to do X, Y, and Z. For us to do X, Y, and Z for this amount of membership will cost this amount of dollars. So we're very transparent. A lot of times with our BPO pricing, it's a per member per month, and that can really vary based on all the things we find in here. Are we using your system, our system? Do you just want us to pay claims, or do you want us to take over all service operations and just own it, and you're just going to concentrate on better clinical outcomes for your members? So here, I think it's just some client partners and accolades. I can never say that word. It's a tongue twister for me for some reason. So these are some of the people that we're currently working with. As you can see, we do have some of the largest payers on there. We do a lot of work with them, and we're a trusted partner with them. Sometimes people ask, do you only work with the big guys where you go with small health plans? And we help small too. We have quite a few clients that are very small health plans, very niche health plans, either a Medicaid or Medi-Cal plan that only works for these particular members with this particular condition. We can really streamline it to base your needs, the client's needs. So when you look at this and you see a lot of the big flags and a lot of the big logos, don't think that that would take you out of the running if you are a smaller plan, because we're very committed to helping the smaller plans be more efficient. So also you can kind of off the right is a few of the awards Catalyst has received. We are a woman-owned business, an LLC. So a lot of times plans need to give a certain amount of business to a minority business, and we fall under that, and we are accredited with that. So we have had, top women-owned business, top private companies. We're located in Colorado, so a lot of these awards are based on Colorado reviews, but we do operate in all states. So that's kind of it in a nutshell. And I know I talk extremely fast, and I'm not sure, Andrew or Lon, if any questions came in, or if anyone on the line has any questions or comments, I'd love to entertain them because we got through pretty quick.
Andrew, let us know if questions came through, and I will join Christine, let her wet her parched throat, and I'll try to join her in answering the questions.
Sure. No, that was great. I did receive a few questions through the chat. To me, the first one for both of you, I'm just going to read straight from it.
Okay.
What does implementation look like, specifically duration? So time from start to completion, etc.
Okay. So it can really vary, because when we were talking about if we're doing a rip or replace, or if we're just replacing one specific component of your existing stack, it can be anywhere from 4 weeks to 6-8 months if we're doing a total rip and replace. So it really can vary, but that's part of that discovery process so that we can be real clear about what the expectations are. So normally, you have a cutoff, and you're saying that after 1/1, we're going to put all new plans on the new system. We're going to do the run out on the old, and then transition over your accumulators. We can do it that way. But that's all part of what we work with, and it really depends on what you're needing from us at the time. I know it's a kind of vague answer, so sorry. I wish I had set in stone that's always going to take 2.5 days, but it just really varies on what you're doing.
Yeah, Christine, I think you make an excellent point about the run out. Part of that process that you mentioned earlier about the interviewing and the kind of getting to know each other is finding out what your needs are, what goals you're trying to accomplish, and then us obviously trying to make that as painless and as quick as possible.
Yep, exactly. And a lot of times with that, we'll say, we need to do a full implementation on this particular component. However, if we just made this configuration tweak today, which would take, 2 days, you get some relief immediately while we're working on the implementation. So we definitely, when we're doing the review, when we see low-hanging fruit, we make the recommendations. Even though we're moving to a new system, let's fix this real quick because it will be an easier transition. So great question.
Yes. What's next, Andrew?
I have a few more on the list. They're coming in. Are there size constraints, i.e. is a plan too small and or too large?
That's an easy question. I'll take it. Tough ones to Christine. No, there are no prohibitions. In fact, tying that to the first question with regards to time, often size has a lot to do with time. The larger the size, often the larger the complexity. But we work with startups all the way to what you could imagine would be a large top 5 sized health plan throughout the United States. So size is not a limiting factor for us.
Exactly.
Thanks. I did just receive another question. So, and seems somewhat related to what was just asked. Do you currently work with any other correctional industry companies?
We do not work with any currently with correctional industry companies. However, I will say we work with a gamut of different products and a gamut of different membership bases. Every membership base, and I would assume the same with correctional facilities, has unique components of it. But we have found that our process and our products are scalable regardless of it. It's Medicaid, Medi-Cal, MLTC, whatever it is that you need, D-SNP, all of it we do. So while we haven't done it currently, I am very confident it would not pose a problem to do.
Yeah, Andrew, I'm curious to know if that question comes from the context of a federal medical prison or if it was another type of a program. But that's just a point of curiosity for me. So if that answer comes in, great. But otherwise, you can move on to the next question.
All right. The next question, pretty straightforward. Are you located in the U.S. or do you offshore all services?
We are in the U.S. Our headquarters is here in beautiful Denver, Colorado, though our employees are located all over the continental United States. We do not offshore. We have nearshore capabilities, but we don't use them very often. We have found historically that certain regions that other companies offshore to, there isn't the base of understanding of how healthcare or Medicaid or Medicare works. So why it might be a cheaper PMPM that you would get with someone that's in a developing country, it doesn't turn out cheaper in the long run when you're touching the claim 5 times. So being onshore and being US based is just the path that we've decided to take as a company, and it's one that we're pretty comfortable with, that we can be competitive with.
All right. Does the health plan have to use Catalyst's systems?
No, absolutely not. We have some BPO customers that use our systems. Like I said, we have others that use other, when we were talking about core systems, we have some that use QNext, Fastest, Health Suite, Health Edge, Amesis. We just VPN. So we have firewalls, secure servers. We VPN to your system. We follow your rules. That way there's complete transparency, and it's just like we're another employee of the company. So we can use yours, we can use ours, whichever best fits the need.
Yeah, and Christine, I would add that going back to the part of the presentation when you were talking about modular, that particular idea is very conducive to that. Whilst you may maintain part of the functionality, having that same system functionality and viewing us as an extension of your team is one of the biggest advantages of not moving to our systems.
I would agree. It's very much a partnership. So we work in partner with the client, with their systems, and we can often spot things that they've overlooked because they've been looking at it for 15 years, where we've looked at how other people have used that same system and say, did you know you can tweak your configuration around your business rules or something like that to get you a little bit of gain. So it's very much a partnership. If we see something, we say something, and we point it out that it could be of help to you.
All right, I got a few more here. How do you help the health plan ensure productivity and quality minimum standards?
Well, we have our SLAs that we kind of spoke to as far as quality and production, turnaround time and things like that. We do have our proprietary audit tool that we use so that we can actually do trending. So let's say the audit results are showing that I'm seeing a whole bunch of coordination of benefit errors on this one plan. My first assumption is that I didn't set people up to be successful, in processing COB claims. So I need to go back in with our training department, talk to them about, how we can do some refresher training, and we pull people off. Whether you got an error or not, everyone comes off and we do some refresher training. So we try to be proactive, not reactive to things. There's no sense to audit unless you're going to use that information to kind of trend what's going on and use it so it doesn't keep happening. It can't just be a stick that you're smacking your people over the head with. It has to be a learning tool, and it has to be a tool that you use to make things better moving forward. That's how we approach it.
And Andrew, I'm not sure if you unmuted everybody, but if anybody wants to jump in and ask a follow-up question, please feel free to do so. Otherwise, Andrew will continue to share the questions that were electronically sent to him.
I'll go ahead, and if it's okay with everyone, I'll go ahead and read through the few other ones that I have here. There's just 1, 2, 3 more here, and then I'll unmute the audience and we'll open it up to any additional questions.
Perfect.
Let's see here. Regarding the SLAs described in the presentation, can those be customized to a health plan?
They can. Obviously within reason, you couldn't say 100% of claims paid within 24 hours of receipt, but we do customize them to the health plan. We actually, our SLAs are to the most stringent compliance standards as far as service level agreements, but we have customized them. And what's odd is we've had some customers actually make them lower, and just because they wanted them to match what they do internally. They are 100% customizable.
Within reason, but I think that's a good point. That
Yeah.
we are following industry standards, probably CMS dictated industry standards, but there are things additional to CMS and/or, as the example Christine used, sometimes what we would do as standard is too stringent. So yes, those are customizable.
Or sometimes, Andrew, we will add other ones to it, like Lon was speaking. We have some clients that have some unique internal processes that they want us to support that CMS really doesn't have an SLA for. And they say, if we give you a help ticket that's a benefit problem or something like that, we need a response within 48 hours. We build those in. We just work with our clients as a team to make sure that the expectations are realistic so that both sides come out with a fair outcome that's manageable.
Right.
Good question. Great question.
All right. The next one, I believe you've spoken to a little bit, Christine. How does pricing work? Do you do a PMPM? Is it a flat fee? How does pricing work?
So, and this is probably more lawn and sales than operations, but I say we can variety different pricing. What we find most people want to do as far as pricing with BPO services is a per member per month. So you take the membership that you have on the month, and we get the membership total every month, and we base it on that. So when we're coming up with the per member per month, you might wonder how we come up with that specific amount, because it really varies client to client. So we have a whole workbook of questions that we ask clients. What's your auto adjudication rate? How many claims are received per member per month? What's your paper rate? What's your adjustment rate? Do you have to manually price claims, or can your system do it? So we really dig into the details to make sure that we give a PMPM that is very competitive, but also realistic. So that's why, when we're going through the process and we're doing interviews and we're gathering all that data and we're looking at your policies and procedures and your process documentation and things like that, that's a critical stage of the assessment, so that we make sure all the cards are on the table for both our clients and for us. And we just found that if we're really upfront and honest about what's going on, we have a much better result.
Well said.
I have one more written question here received. How does BPO impact staff reductions and/or staff morale?
Okay, so we can supplement your staff. So the thing with service operations, especially when we're talking about claims examiners, customer service reps, the attrition rate in the industry is a lot higher than in other industries. So there's a lot of turnover for the clients. So what we can do is we can help backfill that turnover. So, as the client loses people, they could, instead of replacing them with the client, they can say, Catalyst, can you align 10 more people to this and support that way? We've had other clients that said, we want you to come in and be our BPO, but we have some legacy people that are great people, and we've hired those people. And they've come over into the Catalyst family, and we've been thankfully able to retain their knowledge and their expertise and kind of bring them in the fold and move them forward with supporting the same membership base. So us coming in and supporting in a BPO, either in entirety or in part, allows clients kind of to flex. So, we have a really large client where we're doing Medicaid and, more than a dozen states for them. And our claims director, claims managers move those people around daily based on the inventory in those certain states. So we're kind of the backfill. We're the phone a friend for that company. They're saying, this Illinois is spiking, it's crazy, out of control. We need to put 10 people on that for a couple of weeks to kind of get the inventory down. And because we cross-train our folks, we can do that. and just kind of plug and play where needed.
Yeah,
So
that's
kind
a
of
real.
a long-winded answer, but it's kind of a strange process.
Yeah, and I think that's a really great answer, and I think it's a really great question. That's a question that we get almost every time, and I think I'm presuming a bit here, so forgive me for whoever submitted that if I'm missing the mark. But the presumption is that there's a human element there, and while sometimes decisions are the right business decisions, there's always a fear of displacing folks, and I think Christine hit that quite well. That what we see, at least from our perspective, even in a rip and replace, is there's always an approach where attrition usually takes care of the issue. I'm not aware of a situation yet where we've came into Catalyst is coming in as our BPO partner, and you have 90 days to look for another job. We haven't seen that yet, and I think that's indicative of the current marketplace that we're in.
Agree. And I'd also say, sometimes people don't want to voice their question, but it comes to you a little later. Contact information is on the deck that we'll be sending and on the webinar. So feel free to shoot me, Lon, Andrew, an email saying, this popped into my brain after the call. I had a question around XYZ, or I'd like to set up a call so I can get a little more in-depth. Very open to that. That's the whole point of us doing these webinars, is to kind of get the information out there and let people know we're available if needed.
Again, thanks everyone. Take care. Have a great rest of the day.
Thanks, everyone.
Thanks. Bye.